Hi guys, welcome back to the channel. I'm here again with Dr. Kish.
Hey.
And this week we're going to be talking about adrenals. Where do we start with this?
Let's start here.
Dr. J.
So you had some adrenal issues, I think, as well, didn't you? I mean, combined with the thyroid and all this as well.
It's a big soup of mess.
Yeah.
What did you think of my adrenals? Were they hot? Or not?
There's some extremes of adrenal function or dysfunction, you can say. So these are Addison's disease or Cushing's disease. But the vast majority of people, particularly people living where we live, they seem to be sort of in that sort of middle spectrum of adrenal dysfunction, not really in a disease state, but they're just not doing very well. And that just seems to have impact on all of their hormonal balance.
Because we're all stressed.
And this is it. We live in a toxic soup. We live in a really stressed, sort of constant stress state. I don't know, I mean, how often are you sort of saying, doing this, and then I've got to do something else, and then I've got to do something else. It's kind of a never-ending story with our lives as they are at the moment. And I've been looking at that even in my own sort of, my own life. But essentially, I think that's what causes some of the hormonal imbalance that we're seeing. You were under an awful lot of stress before, I think, and that's when I saw some of the things that we associate with adrenal dysfunction in you. You had some weight issues, you weren't sleeping well, yeah, you had sugar and salt cravings. It was really interesting, I think.
And it was flat.
I think you were there are different stages of adrenal dysfunction. So basically the adrenal glands, they're like two almost triangular shaped glands at the back of your body, sitting above your kidneys. And they're secreting a series of hormones like adrenaline, noradrenaline, and the one we really look at first is cortisol. So cortisol is that very, very interesting stress hormone that we needed when we were cavemen. So when we were cavemen and we'd see the Sabretooth tiger approaching or some other extreme...
What are you pointing at me?
Or we'd be under some sort of extreme danger, our adrenal glands would respond with firing lots and lots of adrenal out and cortisol out, because that would dampen down all sorts of things that we normally need to do so that we can focus on the danger at hand. Problem is, we're living in that state now where we're subject to that stress constantly. It's an email, it's a phone call, it's a chat with our boss. And unfortunately, our adrenal glands don't seem to cope very well with that kind of persistent demand.
So the testing that I had, I mean, have I like various different tests done over the years?
You have everything.
I literally do. I've had Dutch done a few times, and I also had 2 24-hour urine tests as well over the years. Talk about that.
These are really interesting sort of tests to test for disease states. And in our capacity, trying to get people hormonally balanced, we tend to do a 4-point cortisol test, which is basically you spit into a sample pot in the morning, later on in the morning, lunchtime, and then in the evening. And that gives us an idea of how your adrenal glands are functioning and producing cortisol throughout the day. The other testing that we do is a dried urine spot test, and that gives us a really good idea of how your body's utilizing the cortisol that's made, and really whether you're making enough or you're making too little, and what it turns into, cortisol or cortisol. So that gives us a much more complete picture of what your adrenal function is like.
And the 24-hour urine? So
I don't do that because that gives, it lets you know whether you're at the disease states of adrenal function, and that's really important to find out, and actually our other test does give us an indication of that as well, and that's when you would be referred to an endocrinologist if you had that specific disease state. But I think the 24-hour collection doesn't give us enough idea about what's happening to you throughout the day. I want to see that diurnal variation, to see, like, are you making cortisol at the right time, which is in the early morning. Within 30 minutes of you waking, you're meant to have a very healthy cortisol spike, and that's the cortisol waking reflex. And that if that's blunted, or if that starts, and that's usually preserved until people become very, very dysregulated. But if that is maintained, at least we know that you're making cortisol at the right time, at least in the beginning of the day.
So why don't we talk a bit about the different states of cortisol dysregulation?
Sure, yeah. So there's 3 states of adrenal function. The first stage we can say is the healthy stage, where we've got a lovely cortisol spike in the morning, and then it gradually goes down throughout the day. We get sort of that afternoon decline as well, and then by night cortisol's gone down so that we can actually sleep. Then we get cortisol dysregulation, where our adrenal glands are producing too much cortisol, and we get a persistent sort of raised level of cortisol throughout the afternoon and sometimes even into the night, where we're getting disturbance with our sleep. We're tired, but we're wired. We don't get good quality sleep either. Sometimes people even become insomniac as well.
So when people are saying that they're doing their best work in the evening...
Exactly. So this is basically an example of someone who's heading towards cortisol dysregulation, if not already there. And that's one of the lifestyle things that we really need to address when we're trying to get people hormonally balanced. And after that stage, we've got the final stage, which is what they used to call adrenal burnout or adrenal fatigue. It's basically an advanced adrenal dysregulation, where you haven't got enough cortisol throughout the day. Your cortisol level is basically much more flattened, and you don't have the energy to do the things you might normally do. You don't have the energy to run from one job to the next. You start to get salt cravings. Even your blood pressure might be low as well. There's a myriad of symptoms that are associated with this, but it tends to be not quite as common as that middle stage, where people are sort of on edge and their cortisol is still functioning, still being produced, and it's really interfering with their sleep and their relaxation.
Let's talk about how we treat it.
You're not going to like this because you like a meaty hammer, don't you? You want a hammer for every problem, for every nail.
I'm not sure that's the best phrasing, but let's go with it.
I've got to be honest, look, I'm into this slightly more holistic approach of looking after myself, and that probably spills over into the way I look after patients. Different doctors for different patients. I think it's an important thing to include for everyone is that we need to start looking at how to bring down levels of stress, manage stress. There's different things you can do. You can use heart math. You can use meditations. I mean, there's some fantastic teachers out there like Joe Dispenza. We can use whatever medium of creativity works for you, but essentially you have to find that time to relax and basically regenerate yourself, and that way that will improve your adrenal function over time, and that's probably the most important thing. In addition to that, you know very well, we can use adaptogens because you're probably on everything. There are certain herbal formulations which regulate the adrenal gland function. So we've got things like rhodiola, cordyceps, Panax ginseng. And then following that, when someone has got advanced adrenal dysregulation, there are other options to replace adrenal function with things like adrenal glandular treatments. And so they're also very popular. But there's a limited time you can use them for, which is why I still go back to trying to encourage my patients to engage with things that are going to nourish the parasympathetic system and achieve some balance in the nervous system.
So let's talk about thyroid and cortisol.
So there's a huge partnership between the adrenal gland function and the thyroid gland function. If we have adrenal dysregulation, it has a direct effect on thyroid function. So essentially we get much less conversion of T4 to T3. So T4 is the non-active thyroid hormone. T3 is the active, metabolically active thyroid hormone, which has wonderful effects all over the body. So we get less conversion. We also get enhanced conversion of T4 to reverse T3. Now reverse T3 is like a fake T3. It's a fake thyroid hormone. It doesn't do anything, but it's just there using up valuable space. We don't want it. It's very, very important that we at least assess or think about treating and managing the adrenal function at least for 6 weeks before we look at the thyroid gland.
Next week we're going to be talking about menopause. So same place, same time. Bye.
Bye.